So today, I want to talk about how to make ADHD treatment work without medication. Now, there is a caveat to this that I really want to emphasize, is that just because one thing works for somebody doesn't mean it works for you. Everybody has different levels when it comes to ADHD and treatment, okay? So it really makes a difference when you understand that. Just because someone was able to have treatment without medication doesn't mean it is necessary for you. This is something that you have to talk with your doctor. This is something you have to make a decision for yourself. But as far as when it comes to treatment without medication, some people do well with treatment without medication. Some people need the medication and do a good combination with the medication as well as natural solutions to implement. Okay. So what we need to understand here is, how can treatment without the use of medication work for you? The first thing that so there's three things I want to kind of cover here. Is the first thing is that if you are going to go down that route, like using natural solutions, it does require a lot of effort, especially for ADHD. It requires a lot of effort in lifestyle changes, implementation, nutrition, really overhauling your diet can make a huge difference, as well as implementation of exercise, keeping your mind optimal. Okay. So understanding that it does require that. Everybody is different. Like I said, some people have more severe issues with ADHD. Some people have less. There's different levels. Not one person is the same. It's the same concept with anybody that has any health concerns, such as like thyroid or diabetes. I've successfully seen people who've been able to get off their thyroid medication, same with ADHD, as well as people who are diabetic are no longer type 2 diabetic. That's type 2 diabetic. Type 1, that's something that's just lifelong. But again, everybody's body is different. And even when patients come to see me, whether it's for ADHD or for thyroid issues, they always ask, can I get off the medications? I'm all like, yeah, I've been successfully able to get people off medication, but it does depend on each person because everybody's body is different. And so understanding that is really important. And the thing is, when you're implementing, nutrition, implementing supplements, the big thing about here is you have to be really careful, especially when it comes to medication. Some people, they get really excited about doing natural solutions with ADHD, and so they go cold turkey and they stop taking medication. Definitely do not do that. That is a big no-no there, because what can happen is when you go completely off the medications, that can cause big side effects when you go completely off of it. The other thing you have to be really careful about is when you're implementing different new treatment, especially supplements, because it can be contraindicated with the medication that you're taking. So you got to be really careful. This is something you still should always cross-reference with your doctor to say, okay, is this okay to take this, or is it not okay? You really have to always be mindful about that when you're implementing natural solutions, especially when it comes to supplements. Food, that's fine. Usually there's not going to be any contraindications with medications with food or lifestyle changes, such as, exercise, and other mindset stuff. That's fine. But when it comes to supplements, since they're also still concentrated dosage, can contraindicate. Now, the problem with, why, because a lot of you probably, coming on here, just like, I've tried different medications and it's just not working for me. I don't like how it makes me feel. I don't like the side effects. I was the same way. I did not like how the medications felt for me, and it just didn't work for me. And that's why, at a younger age, I found natural solutions that really worked for me to help with my ADHD. But again, everybody's at a different level and have different severity of that. But keeping that in mind is, because if something's not working for you, a lot of cases because you were just given to it because there was just one point of information. And so what I mean by one point of information is usually you were given an assessment, questionnaires, and just verbal assessment, right? To be able to determine, okay, now you have ADHD as a diagnosis. And then it's like, okay, try this medication. And then you find that's not working. Then they give you a different medication. So in a way, I think just one source of information is not information to really determine the right type of treatment. In fact, I'd say 3 points of information, 3 witnesses, right? To be able to really confirm that this is the right treatment for you. So what I mean by that, the verbal is good, being assessed by, a psychiatrist, a doctor, to be able to determine whether you have that diagnosis or not. But ultimately, I don't know why, doctors don't really do this, is running further testing. Whether that is just getting a ruling out, anemia, thyroid issues, malnourishment, even just looking at the brain chemistry, seeing if there's imbalances in the neurotransmitters, especially if you're having a lot of these mental health issues, chances are you have some imbalances in neurotransmitters. And the problem is when you try just a medication, for example, like Adderall usually is what it is. It's a inhibitor reuptake of dopamine and serotonin. And so what that means is basically it's blocking that feedback loop, what it naturally does in the brain and the body to stop, to say, okay, we're producing enough dopamine and serotonin. That's what that medication does. Well, it stops that communication. So when it stops that communication, the brain just is going to keep on producing more and more dopamine and serotonin. That's why you get, you feel a little more happier, a little more focused when you're on that medication. But the problem is, what if your dopamine and serotonin levels were high to begin with? That's why people who usually go on some ADHD medications can feel more agitated, feel more stressed, because they probably already had dopamine and serotonin levels were already elevated and they were put on the wrong medication. So this is why it's important to do testing first, because then you can see, okay, is that the case for me? Or is there other neurotransmitters that are out of balance for me? Is my norepinephrine and epinephrine levels out of whack? Or maybe it's hormones. Maybe my cortisol levels are out of whack. Maybe, my testosterone and estrogen and progesterone levels are out of whack. It could be several different things that could be incorporating, or it could be thyroid too. So there's so many different things that get missed. And so when it comes to answering the question, how can using natural treatment work for me without having to use medication? And testing is definitely a big part of it, because then you can determine, okay, am I on the right medication to begin with? And can I use something different, such as if it was a neurotransmitter situation, is there certain amino acids that can help build those types of neurotransmitters without the use of medication? The answer is yes, but then it's not as simple for everybody, okay? But then, of course, incorporating foods that build those types of neurotransmitters. Now, if it's hormones, that's a different story, okay? And trying to incorporate other treatments to build those different hormones that could be out of balance as well. So that's something that you have to kind of understand. Now, the other thing is, third, is that you have to understand if, using without medication, not everyone is the same. And I have to stress this so much, is that not one person is the same, especially with ADHD. And because of that, when you are deciding to choose with using it without or not, and let's say you're taking medications right now, you need to be working with your doctor, but at the same time, you can use natural solutions, treatments, as part of using with medications alongside with it. You can look at it as supportive care, and then over time, you might find you not need the medication, or you start decreasing the dosage. And then, of course, you're working with your doctor, decreasing those dosages, because you're finding that your symptoms have decreased over time as you're implementing the natural solutions for you, okay? Now, you might be at a point where you've never even done medications at all. So maybe that's you. What I would encourage is try doing the natural stuff, start doing testing, run some testing, and start implementing that as treatment. Something that I do with all my patients and clients that come and seek after me to be able to help with that. And first, we got to run testing to see, okay, where are the imbalances, all right? So if you're trying to look to see, okay, can I do this? Can I help my ADHD without the use of medication? It's not as simple, but it is, if it can work, but then you have to be really mindful about first running testing first, and understand that it also takes work and effort to implement these things that whenever you do find imbalances, you're going to have to overhaul your diet. You're going to have to implement more other supplemental things to change your body chemistry, change your whole brain and body chemistry. Okay. But if you're, looking for a way to be able to optimize your brain, to be able to have better focus, to help with improve your ADHD, whether that is for you or you have a kid that has issues with ADHD, I do have a free training that goes over my proprietary process. And that is in the description, whether it's above or below, depending on where you're watching this. And that is definitely want to watch that training, because that goes over my full proprietary process, helping you understand how to use natural solutions to be able to incorporate, to be able to use it for ADHD. All right. So this is Dr. LeGrand. Thank you guys for watching, and I'll see you guys next time.